That first case is probably the one that I'm thinking about the most. The surgery in and of itself is not very difficult. It's something that I've done many times before, but I just don't know what to expect with the equipment. I don't know what to expect with anesthesia. There are a lot of eyes. There are a lot of people in the room, a lot of medical students. I don't know exactly what role they'll be playing. So this particular instance, I really want a good result for this guy, because if I'm not able to get it, then he's going to need a much bigger procedure, and it's just going to extend his cost and potentially put him at risk for worse things happening. But at the same token, you want to be safe. So I'm really hoping that we're able to get this, because if we're able to remove it, then he's done. We'll put a tube down his esophagus just to give it time to rest and heal. But if we're able to get it out today, for all intents and purposes, his problem is solved. So I'm hoping and praying that can happen.
Actually outside of Abuja, so we don't have enough time with traffic to be able to go back to your office. So what's the other alternative? Coming to Nigeria is, I think, the culmination of my purpose, which is, I believe that the Lord has called me to bring hope and healing to those that are suffering.
That, I think, is the seed of everything that we're doing. And we see that Christ used healthcare not as a means to just help people feel better, but he used that as a vehicle to their souls. Why this is the one thing that he did. If Jesus Christ has all the power in the world, why did he not take up politics? Why did he not become president? Why did he not become king? He could have done whatever he wanted, but he chose to heal people. He oftentimes would tie their physical, in every healing, he tied their physical condition to their spiritual. But I think that can be done practically. I think that can be done practically by identifying the pathology of sickness. And if you identify and understand how someone comes to be sick, whether it's an ear infection, or a neck infection, or cancer, or a foreign body in their throat, you can find that the gospel is hidden in there. And then you can use that for that patient to deliver the gospel. And I think it becomes a much more powerful tool to reach someone where they are, so they can get their greatest need met, which is that they need Christ.
My name is Wamanda Faith. I'm a final year medical student here. And we just had a lecture this morning with Dr. Samkon Gado. It was basically on complications of otitis media. And
what you are doing is not happenstance. You are joining Jesus and doing the work that he's doing. And if you don't understand this...
One of the most important aspects of the lecture for me today is incorporating the spiritual aspect of disease to the physical aspect.
You are joining Jesus and doing the work that he's doing. And if you don't understand this, you'll live your whole life practicing medicine as the world does, treating diseases, and not truly treating the source of the disease.
I think that personal motivation combined with understanding that the gospel should be making a tangible, measurable impact in our lives, I think those components really drive for us are at the heart of the Jonah Inheritance.
The medical situation in Nigeria has been very alarming for years. Even though Nigeria arguably has one of the largest economies in Africa, as well as being its most populated country, it still has one of the worst healthcare systems in the world.
Healthcare financing is the biggest problem our people here generally face. Most people have to pay medical expenses out of pocket. And so that means that whatever meager resources they have will have to go into paying for care. And very often medical things can't wait. So it means that they deprive themselves of something else, food, clothing, school fees for children or something, in order to pay medical bills. So
Nigeria's healthcare system is ranked 187 out of 195 countries beneath Egypt, Kenya, and Rwanda.
For us, this mission is really personal. It's our family members, it's our community, it's our country. We've experienced multiple family members that have been in the healthcare system in Nigeria and died. One example is our uncle who was in a motorcycle accident, was taken to the emergency room, was left unattended for hours, and then due to limited staff and resources, and he ultimately passed away because he didn't get the care that he needed.
The World Health Organization recommends a doctor-to-patient ratio of 1 to 600. Nigeria lags far behind at 1 to 4,000. As a result, the total average life expectancy of Nigerians has gone down to just 55 years.
even in the urban areas, the quality of care, of course, compared to the West, is still not, it's not anything close. The availability of physicians, the diagnostics, the therapeutics, it's not always where it's supposed to be. Talk less of the rural places, rural areas where people don't have access to even the basics.
So when we found out that my uncle had passed away because he did not receive the care that he needed, I was at a very young age. I remember I was at school, my father came to pick my brother and I up, and he just looked very solemn and sad, and we were wondering what was going on. He said, "Your mom has been crying all day because your Uncle Finu has passed away." And I think for me as a daughter, it was devastating to see my mother devastated. And then when you hear the circumstances with regards to how he passed away and that it could have been preventable, I think it's a double heartbreak that you have to go through. And I think for me, it left an impression that we have to do something. I didn't know what at age, but I knew I wanted to do something about it because I just truly believe that it doesn't have to be that way.
Every day, Nigerians seek medical care but are often met with the grim reality of not getting the basic medical care they need when they need it the most. Should this continue, Nigerians cannot expect to flourish. This is a multifaceted problem that requires a multifaceted solution.
Apart from my own personal experience, we've lost two dear mothers, in a reputable, so-called reputable hospital, a teaching hospital. And she didn't have to die. It was carelessness. It was nonchalant attitude.
The facilities are not there for most of the places. I have heard and seen, in fact, in my place of work, that one of our staff lost her baby a day or two after. No, even two of them. One lost their baby a day or after, 1 day old. And it has to do with simple first aid. And that has been an area where it has affected the lives of many. It really doesn't take much, but for the lack of the equipment and also lack of good medical care and lack of good knowledge, and also those who have it don't have the resources. Oh, the doctors are not even enough. So you find children are dying and women are dying when they shouldn't.
When I worked with the government facility, I got to find that they didn't have all that was needed to care for the volume of patients that they had. You expect that in a government facility, you see a whole lot more people because they have subsidized rates. But then with that subsidized rate, you have a whole lot more people. You don't have the manpower to take care of those people. So you come to, let's say, an accidental emergency, a casualty. You see a whole lot of people who need urgent care, but they don't get that care when they need it. And trust me, we get to see a whole lot of sad stories as a result of that. I know a number of people who have died because they couldn't get the care they needed at the time they needed it.
Imagine myself some years ago when I was working in the local government in this country, where the medical facility itself are having challenges that are going to infect the patient itself. So imagine myself having to work in a system where the hospital itself is less more habitable than the home of the patient. I saw something I couldn't imagine, that the speculum that ordinarily could have been sterilized and could have been in good condition for this patient was found to be rusty, and this facility was used for a pregnant woman. Ordinarily, what do we expect? This man will come down with tetanus because these are some of the basic challenges that we face: the rising population and the rising medical needs of Nigerians generally.
Crazy that I'm smiling about a situation that's horrible. I mean, Nigeria's ranked has one of the worst healthcare systems in the world, and I think that says a lot. You have a country of over 200 million people, and 8 out of 10 Nigerians receive subpar medical care or none at all. I mean, those numbers are astronomical. I mean, they're devastating. That's a family, that's a daughter, that's a son, that's a community,
So what I've known for some time is that I wanted to return to Nigeria to practice medicine. The Lord had laid that on my heart through a series of events in my childhood, but I never really knew what that would look like. And so I was just planning on pursuing a medical career and then looking to see if my skills will be used in a specific way. But when I came from my away rotation in 2018, and I was given 1 month during my ear, nose, and throat surgery residency to spend time at a hospital of my choosing. And so my father was the president of ECWA, which is the parent organization for Bingham University Teaching Hospital. Once I decided to come and spend some time working in the ENT department, and what I saw was very eye-opening. I saw very talented people, but I saw an infrastructure that was not suited to meet their needs. And so I just started asking the question, does it have to be this way? And if it doesn't have to be this way, what does it look like to change things? And so those two questions began to snowball, and we started addressing issues one by one.
The interesting thing, though, is that Nigeria is the top exporter of physicians in the world. So we can train our physicians, we just can't keep them.
The Nigerian healthcare system is broken, causing Nigerian physicians to leave the country in droves. Up to 80% of newly graduated doctors seek employment outside Nigeria due to inadequate infrastructure, extremely limited resources, and low and irregular salaries.
That's a big problem. Then the third thing will be, I alluded to that in the second point, will be the availability of manpower. And the problem with that, especially from a physician perspective, is that push for physicians to leave the country now. So even in places where ordinarily you have physicians, a lot of them are either just itching to leave the country and go to the Middle East or to North America or to Australia to better their lives or something. So it just reduced the number of hands we have available to provide whatever care the people need here. So poverty, just lack of health infrastructure, and then physicians in particular, just leaving the country, just not being there.
If my country has everything I need, if they have infrastructure, they have the equipment, then there's no point leaving. I would stay. But then if the country has like little to offer, because I as a doctor have fears sometimes, and some of them have actually come to life, so to say, to a very large extent, because there are a lot of things that the patient will need, but you can't do for them. There's so little you can do. Okay, you have the knowledge, but then we still need medication, we still need investigations and all. And then we're doctors today. You can be the patient tomorrow. You can be on a journey. You can have an accident. Nobody knows who you are. And then the closest place you can go to is a primary healthcare facility where they have nothing. What still, you're asthmatic and something is up with your inhaler, and then the hospital does not have a nebulizer or something to help you. So we can also be patients. So this health sector affects everyone. Doctors can become patients, the hazard allowance, the health insurance. So we're like really at risk.
Nigeria at this point is not even offering the bare minimum in terms of budgetary allocation to healthcare. So there's no way we're going to be able to provide that basic minimum. And of course, it's worsened by corruption, and then
money has been placed, the value of money has been placed over the lives of people. What is happening here? I think here everybody is for himself and God for us all. The system is broken. The system is obsolete, and the leadership, there's no leadership at all. The system is corrupted. Even where it is provided by Christians, it's broken.
poverty is the biggest problem. There's a small percentage of the population that is in the organized work sector, in the federal government and state governments, who have access to nationally organized national health insurance scheme, but that's just a tiny percentage of the overall population. So the biggest problem really is having to pay for healthcare from their pockets. Personally, I don't have all the numbers, but we know that a lot of people fall into poverty every year by just paying medical bills. So that's a big problem. I think it really starts from, I think, two perspectives. One is if from the top down, encouraging policymakers and implementers to make the right decisions and then implement them faithfully. But the other way to look at it would be, okay, well, if the government is not doing it, are we just going to fold our hands and do nothing? How can we band it together and pool resources and do something where we are and hope that it will probably grow and spread as time goes on?
Well, when Sam called me in 2018, after doing a month-long residency at Brigham University Teaching Hospital, and he was like, Ruth, I have this idea, I need help. So he has the medical background, I have the organizational leadership background, and I said, I think we can figure this out. And so from that conversation, which was in end of January, beginning of February, we've been planning for this day. And so we planned for this day. We had a marketing fundraising campaign to raise funds for us to come, and people were so generous with their donations and supported this mission. So for us, it's just really a dream come true because we've been planning for years. And as soon as we got into the airport and we sat down and the plane was about to take off, you know, it felt real. It was no longer this idea, it was actually happening. So when we decided to go on this trip, there were a few things that we wanted to do. One was to check out property for our first primary care clinic medical center. The other was to deliver medical supplies. The other one was to do research, do a feasibility study, which essentially is gathering the necessary information that you need so that you can make a well-informed decision. And so for us, this trip was successful in the sense that we pretty much hit on every single thing that we wanted to do. We knew coming in that we may have a plan, we might have to adjust it a little, or scrap it and start all over depending on the information that we received. And so what was amazing about this trip is you literally, my brother and I were talking about this, how we felt God's hand throughout it, and He's brought us the right people to really help us in this process. People that have been serving in the healthcare industry in Nigeria for years, people that understand the context and the issues and are able to articulate that to us. The reception to our vision, it's so humbling to say this, but people were excited. You know, I think that one of the things I observed when we were at Mr. Wabanu's clinic, you know, here's a man that's been serving for years and has been doing innovative things in the lab industry in Nigeria. You could say that he's the father of the lab industry in Nigeria, and how he just loves what he does, you know, and all he needs is support. And I thought to myself, you know, there's countless of individuals like him, and if we can come alongside and support, like imagine the impact if we were to do it together. When we visited Dr. Ade's clinic, our uncle's clinic, the same thing. Here's a man that's retired general in the Nigerian army. He's an orthopedic surgeon. He has a clinic and he's just serving. it just shows that you have so many people that have committed and have given the best that they can. And for us, it's really about carrying that baton. But the reception has been really good. I mean, Bingham University Teaching Hospital, they've been so welcoming. They've been open arms. Everywhere we've gone, people have been, are excited. And not only excited, but they're asking questions and they're giving us the information that we need, because they could truly just keep it for themselves and not say anything. So the fact that they're willing to give their advice and willing to come alongside, that's exciting. And it's rewarding for me to see that in their faces.
What you search for truly you will find. And when you finally share it with the world, what you need is buried deep inside.